Hi, welcome back to the Medical Writing Insider series. Today we have another amazing guest with us. She's a special guest. She's Dr. Sangeeta Dhanuka. So, first, I'll go ahead and introduce Dr. Sangeeta for all of you. Dr. Sangeeta is a medical affairs expert with a long experience in medical marketing and scientific publications. Over the years, she has worked with some global pharma organizations and medical devices companies, including Novartis, Abbott, ICU Medical, IQVIA, Smith and Nephew. She has contributed to medical marketing strategy, KOL networking, scientific communications, and publications across multiple therapeutic areas. A warm welcome, Dr. Sangeeta.
Thank you, Satabdi. That was a very kind introduction, and it's my pleasure to be talking to you. I have observed over the years the way you are helping people get into medical writing. So, this invitation was a pleasant surprise, and I thought, uh, okay, if anything that I share helps anybody, it would be nice.
Thank you so much for doing this, for joining me today. And I am looking forward to an amazing conversation with you.
Same here.
Absolutely. So, with that, I have a list of questions for Dr. Sangeeta because I'm a big fan and I will absolutely make sure that I can ask as many questions to her and get insights for all of you. So, first, Dr. Sangeeta, we think that medical marketing is limited to promotional writing. So, what does it actually involve and what are the biggest misconceptions around it?
First thing, it is not promotional writing at all. So, if that is what people think, that itself is a misconception. So, medico marketing, if I put it in very simple words, is evidence-based communication. So, what we are doing is there are a lot of products in the market existing as well as new products coming in, and there is a lot of research going on, lot of publications going on. Uh, some are good, some are not so good, some are clean, some are not so clean. And obviously, no doctor is able to go through everything yet that gets published. And at the same time, every marketer who's selling his or her product wants to convey that my product is the best because that is what marketing is about. But then here we are dealing with lives of people. So here it is not okay to go and say my product is the best, just like that. And the so where medical marketing or medical affairs comes in is to make sure that you are conveying everything ethically. And by ethically, I mean based on this evidence that somebody is sharing with you, will you be convinced to give this drug to your patient? Forget patient. Will you be convinced to give it to somebody in your family? Will you be convinced to take it yourself? So I'll give you an example. If I present a study of drug A versus drug B, and suppose the study is done in about 10 patients, and the study shows that 7 patients had better results with, drug A. So then I would say the drug A is better because, 7% benefited versus only 3 people with drug B or whatever results I may present. Is that ethical? No, because the data of 10 people is no data at all. So what medico marketing is about uh, communicating evidence-based medicine, and behind the communication goes a lot of planning and strategy. So basically, what you bring to the market, you make sure that there is absolute trust in it. You are not communicating anything which is unethical, or forget unethical. Something that, so if I am a doctor, mostly you will find doctors in the medical marketing space. The reason is, first, are you convinced enough? Like I said, if somebody were to present this evidence to me, am I convinced enough and will I take the drug myself? If 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 I'm convinced, only then am I justified in trying to convince a doctor that, this drug should be given to the patient because of XYZ benefits. So in a nutshell, medical marketing is ethical or evidence-based, not ethical, evidence-based communication is how I would describe it in a sentence.
Absolutely. So that is why I think doctors are very important part of medical marketing
Yes,
strategy.
yes, yes.
Okay, perfect. So, Dr. Sangeeta, we have a notion that doctors can't be good or are not inherently good at marketing. So, is that true?
Medical marketing is marketing.
Yes.
So the job profile itself tells you that that's not correct.
Yes.
So the way marketing works and the way medical marketing works, the difference is that you are trying to be very honest. See, marketing can claim anything. Maybe they don't do it purposefully, some do it purposefully, they don't realize the implications. So when it's not a healthcare product, it's very easy to say something like my floor cleaner is the best. It is a germicide. It keeps your floor germ free for kids. My detergent is the best. It keeps your clothes germ free and all. That's marketing.
Yes.
But medico marketing is not claims in the air. So
Yes.
both are marketing. But medico marketing is based on strong science and it is still marketing. So
Yes.
it's very
True.
wrong to say that doctors cannot be good marketers.
Absolutely.
What medical affairs is doing is in a sense marketing, but it's a very different kind of marketing because we are dealing with lives here.
Yes. Yes. Perfect. So, Dr. Sangeeta, like you have been in this field for so long. So, what are the biggest skill sets that a person, a doctor, if they want to move into medical marketing strategy, if they want to move into medical affairs, they need to develop or they need to hone for themselves?
First is, I think, a lot of passion for academics. So if you think you've got your degree and you're done with the study, or done with studying, not study. If you're done with your academics, you're very wrong. When you are in medical affairs or medical marketing, you need to read more than what you did as a medical student and from a very different lens, because there you are reading to acquire knowledge. Here you are reading to share that knowledge which is going to impact lives. And a medical field is very dynamic. What was true yesterday is not true today. So if you are wanting a career in medical affairs and medical marketing, you need to have a lot of passion for academics. You need to be aware that the amount of effort that you put in as a medical student in reading, you're going to put more than that effort now. Because that time it was just to get those passing percentages or maybe a good score to acquire a degree. Now you are actually dealing with lives and there is a lot of responsibility on you. And to keep yourself, still very, I would not say competitive, but very relevant in the market, your knowledge needs a daily upgrade and you need a lot of hours of studying consistently for as long as you're going to be in this field as a career.
Oh, yes.
And the second, obviously, is conscience and ethics. So I gave you the example of a study with 10 patients.
Mhm.
So as a medical marketer, even if a marketing colleague wants to share this kind of uh, a study or communication based on this kind of a study with clinicians, you are going to be the person who has to put your foot down and say, no, this is not correct. We should not be going ahead with this. So the confidence, or I wouldn't call it authority. Authority will be a wrong word, but being firm enough to say no when you can see somebody is going in the wrong direction and a wrong message is going out to clinicians. The job profile gives you that authority. Many people do not have that authority, or rather, do not use that authority for fear of conflict with your colleagues. But I have been in this space for 2 decades. I have never had conflicts. Never ever. My marketing colleagues have been my closest friends. So it depends on, that is why I said, you need to read so much that you have so much knowledge that when you say no, this is not right, people respect you, and it doesn't, I mean, they don't think that you're trying to block their business or disabling their business strategy. They respect you when they say no.
Mm.
That is the level you have to come up with. That, people don't take it to heart when you say no, this cannot go ahead.
Yes.
They understand that you're doing it for their good.
Mm.
You're doing it for the good of their business and their credit. So, marketing and medico marketing are not enemies or, are meant to fight each other. They are meant to collaborate. And
Absolutely.
it is the medico marketing professional who has to bring in that authority in that relationship through extensive knowledge, which can only come with consistent and lot of reading.
Yes, absolutely. So we need regular upgrading ourselves, upskilling ourselves, reading, researching a lot on our own end before we,
Yeah.
collaborate on a project. And also, you said a very high passion for doing this thing.
Yes.
That is absolutely
Yes.
must, right?
It
Yes.
is mentally draining
Okay.
because,
Mhm.
in a freelancing space, you can say yes or no to a project if you think, it's too taxing. But when you are in a job as a medical affairs or medical marketing professional, you cannot say no.
No. Mm.
Whatever portfolio is given to you is given to you. It's your responsibility. If the portfolio has one drug or 10 drugs, whatever, you're working in an organization, you have to know your therapy area inside out and keep yourself updated on a daily basis. You have to spend a lot of hours reading every day.
Yes. Yes, absolutely. So, Dr.
Yeah.
Sangeeta, with that, I am coming to the next question, which is, can non-healthcare professionals, people who are not doctors, can they come into medical affairs, medical marketing?
I have seen a shift. So back in the days when I was a medical advisor or in senior roles in medical affairs, it was mandatory for you to be a doctor and not even just a graduate, a postgraduate in many organizations. Today, I do see some organizations being open to pharmacy graduates. I don't see that in a big way still. And if you talk of multinationals, uh, they still would want doctors and postgraduates at that. But some shift is happening. Uh, and I don't know how this will play out going ahead,
Mm.
but there is some break in that rigidness.
Yes.
But that's still small, I would say.
Okay. Okay. Yes. Okay.
Yeah.
So, with that, Dr. Sangeeta, I have a question in mind. So, do you think that people who are starting off new, okay, do they need to take some kind of marketing course or something to, get a basic understanding of how this field can work or can look like?
It definitely gives you a plus point if you are making a career in this. So, for example, when I decided to switch from clinical practice and come into the pharma industry, I am talking of uh, 20 years earlier. So that time, there was no way to get in so easily. And I did a full-time 2-year pharma marketing course. And that helped me understand what marketing is and what medical marketing is. And even then, I really have not been in touch these days with, uh, the newer graduates or the companies hiring on campus. But back in the days when I did my pharma MBA, there still used to be no hiring for this role on campus. So I had to get into consulting and then strategic marketing. And then when I did well, I asked my organization for a shift into medical affairs, which was my passion. I don't really know if things have changed because my work has not really allowed me to keep in touch with, what's happening on campuses these days. So I don't know, but having a marketing qualification gives you an edge. Maybe you are preferred over other candidates.
Yes. Yes. Also because our academics don't, teach us to,
Yes,
right, to market or
yes.
to, or the basics of marketing we don't understand. So I
Not
think
at
it,
all. Not at
not
all.
at
It's
all,
not
right?
part
It's
of the medical
not part of the
curriculum at all.
curriculum. Yes,
Yes.
absolutely. Okay. So Dr. Sangeeta, you have also been into scientific publications, right?
Hmm.
So how does scientific publications fit into medical affairs?
So, medical affairs has a lot of things in it. For example, creating a medical marketing strategy, creating a medical communication strategy, KOL relationships and KOL networking, planning clinical trials, and the publication comes into the part of uh, medical strategy, I would say, because uh, companies who are uh, so there are two types of things in it. There are companies who are highly research focused. They spend a lot in research to come up with new drugs and new molecules, or in the case of devices, new types of devices with better outcomes compared to the existing ones. Maybe some new types of stents.
Mm.
Now, just doing the research is not enough unless it is disseminated, right? That is how you will get your regulatory approvals, and that is how you will get your
Market
sales,
approvals.
market approvals, and subsequent to that, sales. So, doing research and the outcomes remaining inside the lab don't help any. So, where publication comes into medical affairs is in the planning process, where there is something called publication planning. So, the medical affairs team is also responsible for planning publications. That I know these studies are going on in my organization. So what is my 5-year plan or 2-year or 3-year plan for publications? And this is not just publications in journals. There are, submissions you make to congresses. So abstracts, posters, oral presentations, and then maybe from the initial data that you are seeing, you know that there is good subgroup data coming. So not just planning the outcome of the full outcome of the study, but also planning subgroup publications that I'm going to publish data of this subgroup of people. Then planning data of maybe when you start a study and you first publish, you obviously have short-term outcomes, right? But in the protocol, you would have had planned for follow-up for X number of years. So then if you plan for 10 years, for example, follow-up, then maybe the first publication is when you have the first results at 1 year. But then you plan for, okay, I'm going to do the next publication when I have 3-year results. I'm going to do it when I have 5-year results, 7-year results, 10-year results. So medical affairs on per se plans the publication. Medical affairs does not necessarily do the writing, but they oversee. So once the writer has written the publication, medical affairs has to approve it before it is submitted anywhere for publication. So
Yes.
that's where medical affairs fits in into publication.
Absolutely. And also, I think we have a research and development team continuously working at the back end to,
Yes.
right, along with the medical affairs team to, they are collaborating and they are on what's
Yes.
happening,
So
right?
yeah, more at a protocol stage, or so the medical affairs does not directly so much interfere with the research team. But yes, when you are planning a study, or when the protocol is being written, or when the analysis plan is being made, so at that time medical affairs inputs are important. And the second type of publication is where uh, you are doing review articles and stuff, which is more, I believe, from a marketing perspective, to kind of keep up the noise levels of the molecule. But that planning happens in association with marketing, and that planning does not happen much in advance.
Yes.
That happens just before we are starting. We think, okay, we want to do a narrative review. Let's plan. Or another area where medical affairs comes into publication is when planning real world evidence. So now, okay, the clinical trials are done, the data is out, but we know that results can vary with ethnic subgroups or whatever, regional subgroups. So then, okay, we have this data now, but to convince clinicians in our local market, we want to generate local data, so which we call as RWE, real world evidence. So medical affairs also comes in when planning these kind of studies where the clinical research team is not involved. So you typically tie up with a CRO, and medical affairs drives those kind of studies completely. The clinical research team is not involved there.
Involved. Yes.
Yeah. So when it comes to RWs, it's completely driven by medical affairs. And yes, subsequently, the publication also is driven by medical affairs completely.
Yes, yes. Absolutely. So, Dr. Sangeeta, any one interesting project that you have worked upon that you really remember or you want to share with us?
There are several, but in the interest of time, I will pick up maybe couple, three, four maybe
Yes.
at the most. The first one I had was, and this remains my favorite till date. This was my first, time I got into medical affairs. I was a medical advisor. The product I was given was degrowing for the last 2, 3 years because the long-term efficacy data showed some challenges.
Okay.
So the guidelines had taken it off from first-line recommendation. So they were not recommending it as first line at all. That challenge was there. Plus, competitors had communicated, data saying that our drug has so much efficacy, this has only so much. The catch was these were not head-to-head trials.
Okay.
So their communication was not very ethical in a sense. And that was the drug I was given. And because it was degrowing, we were having a lot of attrition in the sales team also because people were not meeting their targets, not getting their incentives. Uh, in fact, even medical affairs, anybody who was given this drug would usually quit in 6 months. Over the last 3 years, we had had 6, 7 attritions in medical affairs. And I was, given this drug saying, you are very keen to get into medical affairs, right? So are you willing to take up this challenge? I was so passionate about medical affairs. I said, anything you give me is okay. I just want it. And I took it up. And uh, fortunately, the person who was heading marketing or the franchise was also a very scientifically driven person. You know, both of us sat together and we chalked out some plans. We picked up patient profiles where only our drug had the data, other drugs did not.
Mm.
So we realized that if we try to capture or target the entire universe of patients, we are not going to get there because the guidelines are not in our favor. Let us pick up a subgroup where nobody else has data. And the second thing we did was directly hitting the competitor, which had been communicating that their outcomes versus our outcomes. So what we did was, one was this patient subgroup, and second was we decided that we are going to show, look how their clinical trial was designed and look how ours was designed.
Mm.
So the design was such that they are going to have superior outcome. That's all we did. And two of us traveled extensively, uh, doing this one-to-one communication with clinicians. So I was given the market which from which the maximum sales was coming, obviously, because science needs to be communicated. And in 1 year, we saw 20% growth. That was
Wow.
a big high of my life.
Mm.
That's because doctors, we earned a lot of respect from doctors. That's this team, doctors knew we are massively degrowing, and this team has taken the challenge to
Mm.
come to us with science, which we cannot deny.
Mm.
Simply that respect gave us that growth. We earned a lot of respect due to this effort.
Wow.
So that was one. Second project I remember is for a client. This is from my freelancing space. So they had a cardiovascular portfolio. So some statins, some antihypertensives. Now everything is to be sold. So how do you say this antihypertensive is better or that is better? Or this statin is better or that is better? So this was an entire portfolio for which I had to come up with different strategies so that uh, we create a space for each drug and no drug is hitting the other.
Okay.
So from the whole basket, we cover the entire, all the patient profiles. So that
A
was,
lot of
and that was
strategic
a
planning.
lot because I cannot name the brands here for confidentiality, but these were
Absolutely.
huge brands. So
Okay.
the organization could not afford to take a hit on the old brands because they had no drugs.
Okay.
So that was one, and one or two small ones. I mean, small to say now, but for me they were big.
Absolutely.
So conducting workshops for nurses for a specific type of ICU complication. So we started with planning about 15, 20 workshops in India. And when I speak at CMEs or workshops, I never like a one-way communication because
Yes.
it gets very boring. The audience can doze off. Yeah. So I always keep it interactive. And nurses, I found were very, very reluctant to speak. It was real. I mean, when you do CMEs with doctors and you want to keep it interactive, it's not difficult. With nurses, it was difficult. They were absolutely not willing to speak. And yet I kept up that effort. We started with a plan of maybe 15, 20 such workshops. They were so appreciated that we kept on having demand from India for the next 4, 5 years. We were also covering Southeast Asian markets. So the demand started coming there. And I don't know how much I traveled and how many of those workshops I did.
Oh, wow.
So that was a high again because that's not the plan we started out with.
Yes, yes.
And the fourth one I will name and then I will stop because otherwise our conversation will never end. I think we've already been into it for half an hour. So the fourth one was a kind of technique to prevent some surgery related complications, a use of a specific kind of device
Okay.
and which doctors were not so much using in India
Acha.
because the awareness was not so much there. All this is there in the international guidelines, but
Okay.
nobody was doing it in India. Nobody had built the market in India. So
Mm.
doing many such CMEs, creating a space for a product which had no space at all in the Indian market. So those were some of the highs that I can recall at the top of my mind.
Yes, I think if we had more time, I would have absolutely, loved to hear more from you because actually these are the insights that will help our audience. These real insights that you have worked upon, you
Hmm.
have, planned and you have implemented and how it has worked out, right? So,
Hmm.
yes. So, Dr. Sangeeta, with that, I have one last closing question. So, if somebody is to start in medical affairs in 2026, what is the one piece of advice or recommendation that you would give to that person?
I think, like I said right at the beginning, the mental preparation that this is going to be academics for life if you're going to stay in this field. Uh, Having a strong conscience to, uh, say no. And even if you are starting in the freelance space, maybe not in a job, what brings value also is that in a job, the scenario is different, but in a freelance space, the scenario is very different. A client may come to you with XYZ project. Now you have a choice on just to execute on the lines that the client is asking you to, or to bring in your own perspective and act like a consultant. That I think this will work, this will not work. Out of the things that you're proposing, I think this will not work and we should change. And then giving a better option that this is what I propose, which the client has not thought of. So then, you come across as somebody who brings value to the table and is
Yes,
not
as a
just an
partner.
executor, as
Mm-hmm.
a partner, as a strategic partner and not just an executor. So, uh, again, for that, first, your knowledge has to be robust. Of course, eventually you can you will have to, agree that, okay, after the discussion, this is what we will do.
Yes.
And eventually you have to do what the client wants. But adding something from your side brings in a lot of value, gets you repeat business, because then they trust you completely that, okay,
Mm.
now, if you can do so much, we can focus our energies on other work. We don't
Yes.
need to think about strategy.
It's
You
in
take
safe
over.
hands.
And
Our product is in safe
it is in
hands.
safe hands. We agree with
Yeah.
whatever you do.
Yes. Mm.
So I worked on new launches where, the team have told me, okay, we don't want to waste our time reading because there's a lot to do. We trust you completely. Here's the product. We are preparing for launch. You prepare the strategy. You come up with things.
Yeah.
We trust you.
Absolutely.
That's how it is.
So I think that develops with time, experience, and
Yes,
like
yes,
you
I
have
agree.
been in the field for so long, you have evolved yourself, you have grown into these kind of positions, right? So yes. So thank you so much, Dr. Sangeeta, for all those amazing insights into medical
My
affairs.
pleasure. My
And
pleasure.
for our audience, if you want to connect with Dr. Sangeeta for projects, collaborations, or any question regarding medical affairs that you have, I will share her profile link in the description box below. And till we meet on the next episode with another amazing guest, take care, guys, stay healthy, and thank you again so much, Dr. Sangeeta.
My pleasure, and have a nice day, Satabdi. I hope I did not eat into too much of your time. I
No,
don't know if you had
absolutely not.
planned for this much time.
Absolutely not. I would have loved to
Okay.
continue the conversation, but we can't really right now.
Yeah,
Thank
I
you so
mean,
much.
you got to get back to work.
Absolutely. Thank you so much.
Thank you, and have a good day.